everyone, my name is Daniela and I'm a volunteer at For a Safer Space. Today's video is part 2 of a 2-part presentation on trauma. I would like to begin this presentation with a land acknowledgement. I am conducting this presentation on the traditional territory of the Mississaugas of Scugog Island. While it is important to acknowledge which land I'm on, it is equally as important to understand why we engage in a land acknowledgement. First, acknowledging the land is an act of decolonization. Decolonization is an act that aims to reverse colonialism. It is also significant in understanding history and acknowledging history, as well as showing respect for indigenous peoples and their relationship to the land. However, it is important to not only use a land acknowledgement, but to educate ourselves on historical and current issues, stand with indigenous peoples in the pursuit of social justice, and decolonize our thoughts and actions. Today's agenda will include a brief recap of the last video, Trauma Part 1, followed by the relationship between trauma and social justice, language, misconceptions about trauma, coping with trauma, supporting someone with lived experience, supporting a client, trauma-informed care, and to conclude, resources and key takeaways will be discussed. For a quick recap of Trauma Part 1, trauma describes the emotional consequences that distressing events have on an individual. There are 3 types of trauma: acute, chronic, and complex trauma. There are also various examples of traumatic events. However, an important distinction is an event that one person finds traumatic, another person may not. Vicarious trauma and secondary traumatic stress are often used interchangeably, but they have different meanings. As well, these can be experienced by service providers or other individuals who see images or hear stories that are distressing. There are 4 types of trauma responses: fight, flight, freeze, and fawn. There are also 3 elements of trauma: event, experience, and effect. Signs of trauma vary per person. There are 2 classifications of signs, including emotional and psychological signs and physical signs. Trauma impacts the brain by keeping it in a state of hypervigilance, so that an individual is in a constant cycle of strong emotional reactivity. Trauma impacts the body as well and can increase the risk of developing various physical health concerns. Trauma and mental health are related. The experience of trauma can result in various mental health concerns. In fact, trauma is directly related to PTSD, but not everyone who experiences trauma will develop PTSD. The relationship between trauma and social justice. Due to the vast ways trauma can be brought about, there is a direct relationship between trauma and social justice, and it is imperative that the 2 are not separated in discussions of trauma. For instance, systemic or institutionalized trauma demonstrates this. This type of trauma observes how systems, such as the education, healthcare, or criminal justice system work to actively cause harm on individuals. An example of this would be communities with increased cancer rates because of pollution in their environments, which results in environmental injustice. This is commonly seen in low-income neighborhoods, which results in communities being challenged by trauma of illness and loss. This shows an institutionalized traumatic event, as they are often hidden by institutions. Additionally, social injustice is traumatic, and when this is ignored, it results in blame being placed on individuals who face injustice, rather than the system. Language. Language has an impact and power on those around us. When talking to anyone, it is important to be mindful of what we say. However, this can be particularly significant when talking to those who experienced trauma. This can be called trauma-sensitive language. This is important, for instance, as when talking to individuals with post-traumatic stress disorder, or PTSD, response times often become slower when they hear trauma-related words. This demonstrates how words do have emotional impacts on the individual and how they may process information. 3 key points for trauma-sensitive language is to avoid labels, judgment, and jargon. However, what words we use and avoid is entirely dependent on the individual and the type of trauma experienced. Words used to describe people can also shift and change. For example, the word survivor is commonly preferred over victim, but sometimes victim may be preferred. This can be entirely dependent on the individual and how they have processed their trauma. Next, we will discuss misconceptions about trauma. It is important to deconstruct misconceptions that exist, because they impact how we both view others who experience trauma and our own experiences of trauma. As well, misconceptions play a role in stigmatizing and stereotyping, as well as misinformation about trauma, which can impact survivors. The first misconception is trauma and PTSD are the same. PTSD is a mental health disability that can result from experiences of trauma. However, the majority of those who experience trauma will not develop PTSD. PTSD results from traumatic events that causes flashes, nightmares, irritable behaviors, social withdrawal, and avoiding specific places or individuals. Trauma, on the other hand, derives from the emotional and psychological impact an event has. Another misconception is trauma only derives from life-threatening events. While life-threatening events can result in trauma, trauma does not always result from life-threatening events. There is no specific event that results in trauma, as experiences of trauma and how they impact someone are so individualized. The next misconception is being challenged by trauma shows weakness. This is untrue. Nobody will experience trauma in the same way, even if they have lived through the same event. Varying circumstances can impact how individuals process and experience an event, and this can alter how they may harm them psychologically. However, when individuals do feel challenged by trauma, it is not due to weakness, as trauma is a complex experience. Finally, it is impossible to recover from trauma. Trauma can impact someone's life greatly, but it is possible to recover and cope with trauma. There is no one path to healing from trauma. However, there are steps that can be taken to minimize the negative impacts of trauma, which will be discussed next. Coping with trauma. Similarly to how no two people will experience trauma the same, coping strategies will differ per person. However, there are steps that can be taken to cope with trauma that have been shown to be beneficial. The first method is reaching out to loved ones. Loved ones can offer support when ready to talk about a traumatic event, as well as a safe space to discuss feelings. As well, it is important to try not to avoid. It is normal to want to avoid thinking about trauma and a traumatic event. However, this can be unhealthy in the long run and worsen the stress experienced. It is important to gradually fall back into a routine. Self-care. Self-care can be especially important as it can be easy to forget to eat well, get exercise, and sleep. However, these are all beneficial in looking out for mental health. Healthy coping strategies such as art, music, meditation, or other methods that have personal meaning can all be beneficial methods of self-care. And finally, be patient. It is important to remember that strong reactions to traumatic events are normal, and it is important to take things slowly and be patient and kind to yourself. Supporting someone with lived experience. Additionally, there are ways to support and help others who are being challenged by the impacts of trauma. Such methods include listen. Sometimes individuals do not know how to react or what to say when someone shares their trauma. However, it can be important to listen to them rather than asking questions. Some other key components of listening in a way that is beneficial is to go at the individual's pace, validate their feelings, avoid assigning blame, mimic their words and how they discuss their trauma, avoid dismissing their experiences, and if giving advice, ensure it is always welcomed. Additionally, it can be important to learn about triggers. Learning what someone's triggers are can be beneficial, as it can help to avoid certain situations that may result in negative outcomes, as well as prepare you for when these occurrences happen so that you can best support. Avoid judgment. Without experiencing a certain event from another person's perspective, it is impossible to understand how it has impacted them. However, it is important to ensure that they are not blamed and there is no additional pressure to move on. Respect privacy. Help them find support. This can be by helping them look into professional supports or support groups that are available. And most important is self-care. It is important to look after one's own mental health as well by setting boundaries and managing stress. This next section will discuss supporting a client, trauma-informed care. Specifically to be covered is what is trauma-informed care, principles of trauma-informed care, and why is it important. What is trauma-informed care? Trauma-informed care recognizes the fact that practitioners need to fully acknowledge the presence of trauma and its impacts on the individual. This type of care aims to acknowledge the large impact trauma can have, as well as the various paths to recovery, acknowledge signs and symptoms of trauma, focus on adding knowledge about trauma into policies, procedures, and practices, and work to avoid re-traumatization. As well, important to this is also focusing on trauma-informed care at the organizational level, to produce changes in small interactions that help to ensure a safe environment. Principles of trauma-informed care. There are several principles of trauma-informed care, including safety, as there should be a push for physical and psychological safety of all parties. Trustworthiness and transparency. Any choices that are made focus on transparency. This is with the intention of developing and keeping trust. Peer support. Individuals with shared experience are available to offer support through the shared lived experiences. Collaboration. An imbalance of power is inherent to any practitioner-client relationship. However, trauma-informed care works to equalize the power so that decisions that are made by all parties equally. Empowerment. Strengths are acknowledged, strengthened, and validated through centering resilience and healing from trauma. And finally, humility and responsiveness. Biases, stereotypes, and historical trauma are acknowledged and addressed. Why is it important? Often systems are created without keeping trauma in mind, which can work to re-traumatize. However, trauma-informed care is significant in ensuring that this issue is highlighted so that changes can be made while centering the existence of trauma. As well, trauma-informed care works on all levels to fully support clients and other service users. Finally, trauma-informed care is significant in creating empowerment for those who work in the system as well as clients. Now we'll go over resources. The most important thing to take away from this video is that there's supports and help available. For an immediate mental health crisis, reach out to a crisis line for support. For non-immediate mental health support, a useful resource is For a Safer Space. For a Safer Space is a nonprofit that offers accessible and inclusive mental health care. Visit the website for more information if you would like to reach out for support. To conclude this video, we will go over some key takeaways. There is a distinct relationship between trauma and social justice. The two cannot be separated, as a lot of trauma can be the result of social injustice. As well, it is important to center trauma-sensitive language in discussions about trauma to best support survivors. There are various misconceptions about trauma. It is important to deconstruct them as they spread misinformation, stereotypes, and stigma. There are various ways to cope with trauma, which, similarly to experiences of trauma, can be very individualized. Individuals can support survivors of trauma in a variety of ways, but it is important to center self-care. To continue with some key takeaways, practitioners should focus on trauma-informed care in practice. Trauma-informed care recognizes that trauma and the impacts on the individual need to be fully acknowledged. There are various principles of trauma-informed care, as discussed. Finally, trauma-informed care is significant for various reasons, especially through its acknowledgement of the role systems play in trauma. That concludes Part 2 of the two-part presentation on trauma. Thank you for watching.